I'm Marta Pierzaday, Infant Safe Sleep Campaign Coordinator with the North Carolina Healthy Start Foundation. The foundation has coordinated North Carolina's Back to Sleep campaign since 1994. Research shows that placing babies on their backs to sleep can greatly reduce the risk of SIDS, but not all parents do this. SIDS stands for Sudden Infant Death Syndrome, commonly known as crib death, and it is defined as the sudden, unexpected death of a healthy infant under 1 year of age, based on 3 things: an autopsy, a death scene investigation, and a complete family history or medical history of the baby, when all other causes of death have been ruled out. I'd like to talk to you about some of the challenges to back sleeping and dispel some of the misunderstandings related to it. Most of these challenges can be overcome with education and an understanding that back sleeping really works, and it does reduce the risk of SIDS. Some people wonder, won't my baby choke and suffocate on his back? No. When a healthy baby spits up, he automatically swallows the fluid or it dribbles out of his mouth. Also, when a baby is lying on his back, the food pipe or esophagus is below the air pipe, so gravity helps keep the spit up lower, out of the air pipe and lungs. Many studies show that there has been no increase in choking or other problems for babies who sleep on their backs. One of the main reasons that parents don't place babies on their backs to sleep is fear that the baby will get flat spots or a flat head from back sleeping. A flat spot on the back of a baby's head is usually a temporary condition that goes away as the baby becomes more active. Spending a lot of time in car seats, infant carriers, swings, or strollers puts constant pressure on the back of the baby's head, as does spending all day on his back. The important thing to remember is back to sleep, not all day. Allowing enough tummy time when baby is awake will generally help reduce or prevent flat spots. Encourage the parents that you work with to hold their baby, play with her, give her lots of tummy time when she's awake. If it seems like the baby has a more serious problem, the parents should talk to their doctor. One of the main reasons that parents don't put their babies on their backs to sleep is because other people tell them it's not necessary. Grandparents, friends, even medical professionals tell them they don't need to put their baby on their back to sleep. But research shows that back sleeping is the most effective way to reduce the risk of SIDS. This recommendation has changed over the years, but since 1994, the American Academy of Pediatrics has recommended back sleeping as the only safe sleeping position for babies under 1 year of age. Many babies seem to sleep more comfortably on their stomachs, but they can get used to back sleeping. It might take some patience and consistency on your part, but if you start to put your baby on his back to sleep as soon as possible, the transition is much easier. If your baby goes to daycare in North Carolina, all licensed in-home and daycare centers are required to put infants under 1 year of age on their backs to sleep. So if you've already started putting your baby on their back to sleep at home, this transition will be much easier. Back sleeping has been shown to be the most effective way to reduce SIDS. The risk of SIDS is more than 2 times greater when a baby sleeps on his stomach, depending on what other risk factors are present. Even though there may be some challenges to the initial placement on his back, the risks of stomach sleeping are just not worth it. Your baby will get used to sleeping comfortably on his back.